Welcome, everybody, and thank you for joining us today. My name is Andrew Dauphiny, and I'm the Instruction and Outreach Librarian at the New Jersey State Library. And it is my pleasure to present Mark Brownstein, who is going to present on Medicare today. First, a little bit introduction on Mark. He is the Director of Medicare and Risk Management for Emerald Medicare. He is a trusted, independent, and dedicated provider of comprehensive and competitive Medicare solutions. Mark has extensive experience working with individuals, CPAs, tax professionals, and financial planners implementing Medicare solutions to meet clients' changing needs. His passion is working with seniors by providing insight and education on a topic that has value and is valued. So, everybody, if we were in person, we could welcome and clap for Mark as he gets ready to present. Before that, I have a few housekeeping items to go over. We will be taking questions today, so please ask them using the questions box in the GoToWebinar dashboard, or you can email me directly. My email address is on the screen, and it is adauphinee@njstatelib.org. And you can send your questions in at any time, and then we'll take care of that. There are a bunch of handouts for today, including a copy of the PowerPoint slides, some brochure information with things as enrollment dates, and just some other great things provided by Mark. So please download them from the handouts section of the dashboard. You can just click on the file name and it'll download. There have been reports that sometimes they are not loading in Google Chrome. If that's the case, you can try another web browser to do that, or I will make sure that everybody who has registered for the program gets copies of them in a follow-up email. So there will be a survey available at the end of the webinar, as well as in a follow-up email. If you could please complete that. We greatly appreciate your feedback. It really helps us to develop our programming and make sure that we are providing quality programs for all of our patrons. One more thing, if you are looking for more information about Medicare and choosing maybe the right plan or the options that are available, you can visit Emerald Medicare at www.emeraldmedicare.com. For those of you who are new to GoToWebinar or maybe are unfamiliar with how it works, this is what your dashboard should look like. If you do not see your dashboard, look for this orange box with a white arrow either at the top left or right hand side of your screen. That button will open and close the dashboard, so it's possible that the dashboard loaded closed when you launch GoToWebinar. If you have any problems, can't figure anything out, if you're running into issues, you can use this raise hand button here that'll alert me that there's something that you need help with, and I will get in contact with you and hopefully be able to resolve your problem. As I said before, there are handouts for today. They'll be right here in this section, the handout section. We have 5 for today. So please take a moment to download them and find out all the great information in them. And lastly, there is a questions box. So if you have any questions, you can type them in here, hit send, that'll get sent to us, and then we'll be able to answer them for you. So that is all that I have. So I'm going to change it over to Mark.
Can you see the PowerPoint now, please?
Yes, yep, everything looks good.
Okay, great. Well, good afternoon, everyone. I am so honored and pleased to be here today to present to you some information about Medicare. Medicare is my world, is my life. It's what I do every day, 12 months a year. This is not a part-time business. This is a full-time career where I help hundreds and hundreds of people every year understand Medicare. Clearly, the seminar model has been put on hold, and now we're all experiencing webinars in a new way. And so I've been doing quite a bit of these, and I'm very grateful that I've been asked to speak to you today. So my goal is to take the mystery out of Medicare, though I can tell you that each and every one of you on this call has a different reason for being on this call, has different sets of questions. And though I can answer some of the questions through the chat, and as you're communicating to Andrew, so much of the work that I do is with individual phone calls or meetings with people to really understand their health, their budget, their doctors, their prescriptions, and to really understand the challenges that they face as they transition from a group plan of some sort or the Affordable Care Act over to Medicare. So again, thank you for attending. Thank you for taking the time today to participate. And just to get started, it's really about this confusion of Medicare. People ask questions about Medicare, and it starts around age 64. The thought out there in the world is that maybe Medicare will start for people less than 64, but who knows where that will be. Right now, it's for people who are 65, or people who are on Social Security disability for greater than 2 years, they get Medicare. But the confusion is, what are my options? What if I don't want to retire and I still want to work? And can I defer parts A and B? And so the guidance that you get from me or anyone else is really, as you turn 64, as you get ready to retire post 64, is to know what to expect. So I guess I'm curious, Andrew, if you're going to pull up the poll questions just to see if I can get a sense of the audience that I have here today as I proceed through this. So I guess the poll is open. If the folks here on this call can just take a few moments with your mouse or your finger to answer the questions, that would really be great. And once that's done, I will continue in earnest with the rest of the presentation and help you understand more about this Medicare confusion. Thank you. I hope all of you are safe in this summertime and as we approach the end of summer. Believe it or not, we are approaching the end of summer. Maybe the days will cool down. So again, I want to remind everyone that there's these handouts. Okay, so it looks like you've got some answers. Let's see. So Andrew, are we waiting still for people to answer the questions?
This is the results for the first poll. So
Okay. I'm looking to see where those answers are.
it should be on your screen. One moment there.
Here we go. Okay. Okay, I see the first question. Got it. Okay, that's great information, folks. When you'll be turning 65. That's super information. Thank you. That's the next question. When you will be retiring after age 65. Okay, again, very interesting. Okay, so retiring and turning 65. Again, people look at this 2 years out or less. This is great information. Wonderful. A few more questions and then I will start up. Simple one. Do you have Part A? So Part A is easy, it's free. People at 65 often get it. Not everyone though. No, okay, all right now, okay, so the next question is going to be a similar answer then. Probably a little bit more, no. And after that, there's only one more question, folks. Okay, that's what I thought. And one last question for those who do have Medicare at all. Again, the answer is what type of coverage do you have? And this is just giving me a sense of the kind of presentation and the orientation of the presentation that you have coverage now. So thank you so much for answering these questions. I really appreciate it. Okay. Okay, very interesting. Okay. All right, so I'm ready to sort of begin. We're back to the presentation now. So here we go. So this is the agenda. We're going to talk about the introduction to Medicare, but we're also talking about what's really important, which is applying for Medicare. Getting Part A and Part B is confusing to so many people, and that's often where I start conversations with people. When they're applying for Medicare, they want to make sure they do it right. There's original Medicare. People know about Medicare. They like the flexibility of doctors with original Medicare, but original Medicare is only 80% coverage. So the question is how do you supplement that coverage beyond original Medicare? And that's certainly a big part of what we're going to speak of here. What are those premiums that you can encounter for A or B? And what are those enrollment periods that you have to sort of look at when you are either turning 65, retiring, moving in and out of your state or your county? What are those enrollment periods? And of course, October 15th through December 7th is when so much mail, so much TV and radio comes to bear. Everyone thinks that that is the only enrollment period, but that's not true. There's an income adjustment that happens for Part B and Part D that goes back to 2 years ago's income, and we will cover that. We will cover Med Advantage, which is also called Part C. We will call Medigap also Med Supplement, but is the two options that is Med Advantage and Medigap that is often the choices when one does decide to go towards Medicare. Medicare prescription drug coverage is Part D. New York, New Jersey, which I believe most of you are either from or work in either of those two states, they have pharmaceutical assistance programs, which helps reduce the cost of medications. And then there's extra help and low-income subsidy and dual special needs and Medicare savings programs, all a part of what will help with copays and costs that are important to some of you, if not all of you. So the frequently asked questions that come up often in the work that I do is, how do I transition to Medicare, or do I transition to Medicare? Am I being offered a retiree package from my company? That's hard to beat. I see it all the time. There are some wonderful retiree packages that are out there, whether it be state employees, federal employees, teachers, even some of the larger companies offer some great coverage. So Do I transition? Should I transition? What is the best timing to get onto Medicare? People hear about that dreaded penalty, but the timing is important. And of course, everyone wants to do things right. And one knows that at age 65, one needs to even consider it, have the conversation so that they have peace of mind. So when and how do I enroll in Part B? Part A is free, and I'll talk about that, but Part B is really critical. What are these Medicare Parts A, B, C, and D? And I will explain them. What is included in any supplemental plan? And we'll cover that. When is Medicare primary and when is it secondary? That's important for group coverage. That's important if one is retired. It's important to know when you're going to get a bill and who pays the bill. And what are the potential savings by being on Medicare? In some cases, there is savings. In some cases, there is not. But it certainly should be evaluated. So this is health insurance. This is health insurance that's available by the government at age 65, or again, if someone's on SSDI, Social Security Disability, for greater than 2 years. So what are those choices that people have at age 65 and retired? What are the rules around an HSA plan? Many of you may have an HSA plan, and in Part A, you cannot have an HSA plan if you're 65 and have Part A. But often I work with people to compare their group coverage or retirement healthcare coverage to Medicare choices. Some are very good group plans and retiree plans, and some are really costly and don't cover as much as people would have hoped. And Medicare does become an option. In some cases, it's about the spouse as well. So what are those premium costs as an employee or a spouse? Some people aren't 100% certain, and they need to look it up or call their HR department, because the spouse's premiums are likely different than the employee just because it's subsidized at a different level. Take a look at your copays, your deductible, your out-of-pocket maximums, because that's how we're going to best compare your current plan to available Medicare choices. Again, I noticed from the poll questions that many of you are going to be retiring in a couple of years. You don't have B, which means that a lot of these explanations are going to be valuable to you. But to get an overview of these supplemental plans available in your state and county, whether you're staying in the state you're in or the county you're in, or you're moving in a year or 2 or 5 when you retire, these are important decisions and discussions when it comes to what kind of plans are available and what are the rules in different states. But overall, you want to, I believe, find the coverage that best suits your budget and your healthcare needs. That's very important and a lot of the work that I do. So again, what is Medicare? It's a government health insurance program for people over 65, SSDI, 24 months. It's administered by what's called CMS, which is the Centers for Medicare and Medicaid Services. You've probably seen them on the news lately a little bit because they also have some connection to the nursing homes and all of the experiences that has been going on with COVID. They've been involved as well. The enrollment, though, is by the Social Security Administration. And many of you are probably aware that the Social Security offices have been closed. And we've been navigating through that for our clients because they do need to communicate either by phone or fax or online to the Social Security office. This is not connected to veteran benefits. However, I do presentations for veterans because veteran benefits can work separately, but can be of great value to have both Medicare and veteran benefits for those people who understand what is available to them. So original Medicare, I talked about that. Again, 80% coverage, but Part A, for almost everyone that I speak to is zero premium. This is based on the fact that you or your spouse has worked for 10 years in the United States and have been paying into Medicare. Either one of you, even if one of the spouses never worked, they would get Part A for free, no cost, as long as one of the two have worked for 10 years or 40 quarters. But what does Part A include? It includes inpatient hospital care, skilled nursing and home health, hospice, basically hospital admission. Okay, that's Part A. So if one has Part A at age 65, this is basically going to be where Part A Medicare will be primary and your group coverage will be secondary. Okay, so Part A at 65, I'd say 70% of the people that I work with get Part A at age 65, but you do not have to. Part B, on the other hand, there's a cost to it. It is all the rest of the doctors and specialists and preventative services and labs and x-rays and non-inpatient durable medical equipment. But there's a premium for Part B, which makes Part B and the decision to get Part B, and most of you on this call do not have Part B, and the decision to get Part B is 100% connected to whether you are unemployed, self-employed, or working for a company of less than 20 employees. So if either one of those three things are in play at age 65, you have to get Part A and B. But for those who are working for a company greater than 20 employees, you do not need to get Part B. Again, Part B's base premium is $144.60 per person per month. So clearly the decision to get Part B is something that should be done carefully with full information, knowing that you can do it at the right time when necessary. And I will cover that a little bit more later. So what Medicare does not cover is also important. It doesn't cover long-term care. It doesn't cover custodial care. It really picks up, Medicare only covers sort of medical coverage. It's not chronic. So the routine dental or eye care isn't covered, but major eye care like cataract surgery or diabetic eye checkups are covered. Hearing aids and exams for fitting them, dentures, cosmetic surgery, acupuncture, routine foot care. These are not covered by Medicare, but in some cases covered by these Part C Med Advantage plans, but none of them cover long-term care. Some of them cover more than the other of home health, but long-term care, there's long-term care policies that are out there, but this is what Medicare does not cover. So again, Part A, no cost, premium free. If you do not have the 40 quarters or 10 years, you can still get Part A, but you would pay a premium, okay? And so again, not too many people that I've worked with do not have eligibility for Part A, but one can still buy into Part A. One is automatically enrolled, however, in Part A when one is collecting Social Security. So if you're getting Social Security, maybe you're getting spousal benefits, maybe you're getting SSDI, maybe you chose to get Social Security benefits before the age of 65. When they send you the Medicare card will have Part A and B on it. It is really important that you take note of that Part B piece, because if you do not return the card and reject Part B, you will start to be charged for Part B, and the amount of money for Part B at the baseline again of $144.60 a month will come out of whatever check you're getting every month. So again, if you're getting Part B and Part A in a card being sent to you and you are working for a company larger than 20 employees, then you would need to reject it because you don't want to begin to pay for it unless you have to. But there are ways to enroll. Most of the people I work with either go online or call the Social Security office to get a phone appointment. Online is relatively straightforward. When you get to the part of online, whether you say yes to Part A and or yes to Part B, this is where one needs to be certain that they're making the right decision. You can also fax some forms to the local office, which is what we've been doing for dozens and dozens of clients since COVID has begun. Part B, again, baseline $144.60 a month for 2020. It goes up slightly each year. It was a little lower last year, but this is baseline and it's based on income. And I will talk about that on the next screen or two. But if you missed the Part B enrollment period, you have a general enrollment period that's very specific. If you miss Part B for whatever reason, then you have from January 1st through March 31st each year to apply for Part B. But the coverage is not effective until July 1st. So that's really important because you want to, again, make sure that you get Part B at the right time without any concern for this premium penalty that's a bullet there below. So Part B, the timing of it, if you do miss it, you do have an open enrollment period, general enrollment period, but it doesn't come into effect until July. But it's very important for you all to understand that you can delay Part B if you're covered under a current employer health plan. This is the employee or the spouse. But remember, the size of the company matters. I say 20 employees, but I've talked to medical offices that were 35 and they've called the insurance company and they said, no, there's only a certain number of people on the plan and our rules state that you still need to get Part B. I always make sure that I mention to people who I speak to be 100% certain that you have confirmed that you do not need to get Part B at 65. For those people who are already retired and on a retiree plan, it is in most cases necessary to get Part B at age 65. There are some instances where that is not the case, and that includes federal employees. But for a state, for police, for fire folks, for school, for most corporations, getting Part B on a retirement package is important and in fact necessary, needs to be confirmed, keeping in mind that Medicare becomes primary and the retiree plan becomes secondary. So at the point in which one needs to or has to get Part B, there's a form that needs to be filled out by the Human Resource Department verifying that one had credible coverage after the age of 65. So you may or may not be able to see the screen very well, but this is one of two forms that are necessary. If you have Part A, and I did notice from the poll that a certain percentage of you did have Part A already, you cannot go back online and get Part B. So this is where people would generally go into the Social Security office, hand them this Part B form, they sign this form, they put in their Medicare number that they've gotten for Part A, and in the remarks section at the bottom of this form, it would say, I request a Part B effective date of, let's say, November 1st. And then if you were handing it to them, they would stamp it and say, yes, November 1st is your date. On the other hand, we've been faxing this form to the local Social Security offices along with this second form. This is the form that is verifying that an employee or the spouse had credible coverage after age 65. So this is a form that all HR departments, all companies that have had employees past the age of 65 have seen. You can see this is the entire form. The only thing missing on the bottom is the signature. So it's asking for the employer's name and address, and the applicant's name is actually the spouse. It's followed by the employee's name, which is the employee. And then in the middle section, it talks about when the person started at the job. It asks when they had coverage and when the coverage either ends or doesn't end. So people can still be working and go on to Medicare and buy a supplement. Because in fact, it's very true that in most cases, the employer will save money if you go on to Medicare and get a supplemental plan. I've seen half the cost of the best coverages that are out there compared to group coverage. Whether it's $1,200 or something around that an employer and or an employee pays for decent group coverage, it could be actually less than half of that for Part B plus a supplemental plan. But these two forms, the Medicare Part B form and this employment verification form, are the two forms that either one would go into the Social Security office with, or would fax, or we would fax these forms to get Part B in place on whatever date was necessary. If you were retiring October 31st, we would want to make sure that this began November 1st, so there was a smooth transition, no drop of coverage. You would just transition right into Medicare. So how do you pay for this Part B premium? This Part B premium does come out of your monthly Social Security check if you're getting Social Security. But if you're not getting Social Security, it's billed every 3 months. So a 144.60 times 3 is, I believe, $433.80. And that's the amount that you would be billed for quarterly that you would pay to keep current with those Part B premiums. No matter what you do in the world of supplemental coverage, remember, A and B is 80%. If you're going to get any supplemental plan, you have to keep Part B premiums current. So I'm just letting you know that. And then there's this income adjustment. Again, I'll show you on the next screen, is that it looks at modified adjusted income from 2 years back. So for some people, maybe are getting a severance, maybe they were working and they were making decent money and now they're not working and now their income is lower. They can submit what's called a life-changing event form, which sort of appeals to the Social Security office to lower your Part B premium, because this is the impact of having higher income in previous years. So again, this goes back 2 years, modified adjusted gross income. It's per person per month. Okay, so it's the same premium for the spouse. So you can see that any married couple under 174,000 or any single individual under 87,000, the number is 144.60. But if you look at the tiers that are below that, you'll see that that number 144.60 goes up, and it goes up considerably for high income earners. So there are people who have maybe sold a piece of property, or maybe are taking required minimum distributions, or maybe having some Social Security income. All of these are connected to financial planning potentially, but these Part B premiums can go higher. These tiers can change somewhat year to year, but some of this does require some planning, and in some cases, an appeal to Medicare to get that lower premium for yourselves. So this is sort of the, am I required to Medicare A and B slide? Well, no, maybe, yes. So if it's no, if you're actively working and you've got credible coverage, okay, that's a no. Maybe is it depends on the size of the company. You're actively working, and depending on the size of the company. But yes, if you're not working, if you're self-employed, working for a small company, retiree coverage, COBRA, severance, those are yeses. So this is where people want to be certain, And this is what I've tried to explain up until this point. So this screen here is about the enrollment periods, and this is where a lot of confusion comes in the marketplace, is that the initial enrollment period of that 7-month window that people often speak to me about and you've heard about is, again, for people who are turning 65, who are self-employed, unemployed, or working for a company of less than 20 employees. That 7-month window is 3 months before your birthday, the month of your birthday, and 3 months after your birthday. That's your enrollment period if you, again, are working for a small company, self-employed or unemployed. Okay? This is where you need to take action because you don't want to get penalized and you don't want to have to wait another January through March to apply. Okay? The annual enrollment period is this period of time where all of the paperwork comes to your home, all of the TV and radio ads are just nonstop. This is October 15th through December 7th. It's a small window of time, but it's only really for people who already have a Medicare supplemental plan. So if someone has a Med Advantage plan or a Med Supplement plan, they can make a change during this period of time. We reevaluate people's health and their budget during this period of time. We look at their doctors. We look at their prescription medications. I do not see all of the plans until the middle of September. I cannot speak about a plan until October 1st, and I cannot sign up an individual for any other Medicare plan until October 15th. So this is that annual enrollment period that comes around every year that people reevaluate their plans. Many people, most people in the country actually stay the course, but there are benefits that you'll hear about in a moment that make people change. It could be dental, it could be vision, it could be hearing that make people want to investigate options. This open enrollment period is this period of January through March where you can apply for Part B, which is actually also called general enrollment. But if you have a Part C plan and for any reason you don't like it, you actually have this 3-month window to make a change. The special enrollment period is really helpful for many people around the country because, one, it really is often used for people who are leaving their employer group plan. So if you are retiring or laid off or furloughed at the end of October, you have a special enrollment to move into Medicare November 1st. So these SEPs, the special enrollments, there's about a dozen of them. And they include people who qualify for Medicaid and Medicare. They include people who are on sort of what's called extra help or low income subsidy, which allows you to get discounts on prescription drugs. It also is for people who have coverage that is terminating for whatever reason from a company that may have gone out of business, but also people who have left their county. If you've gone from Bergen County to Monmouth County, you actually have an open enrollment for the purposes of the Med Advantage plans. So these special enrollments are important. But I'm going to keep it simple for you folks. I'm going to let you sort of see this screen and know that there are 4 choices. Those are the choices you have when it comes to your healthcare choices. Really, at age 65 is what I'm referencing here, or on Social Security disability for 2 years. Is 1, stay on your employer group plan. Every week, I spend probably an hour or more reviewing individuals' employer group plans or retiree group plans to see if it is better or not, more cost effective or not for themselves or their spouse to stay on their employer group plan or to move to Medicare. So often I'm being sent the details of the employer group plan or the retiree plan, and I'm helping people look at their plan and comparing it to Medicare. Yesterday, I reviewed a plan that was absolutely excellent, and I recommended them just stay on their plan. If the prices change or if the benefits change, call me back. My services are free. I'm happy to do this for people. I'm happy to review their group plan. I'm happy to have them stay with what's working. And someday they may move to a Medicare option, and I'll be there to help them. Number two, though, is Original Medicare. This is where you have the flexibility of any doctor that takes Medicare anywhere in the country. But it's only 80% coverage. And so the risk here for people who just have Original Medicare is that you are responsible for 20% of Medicare approved charges. And it works well if you're seeing a doctor on occasion, but the cost is, as you would imagine, sort of hospitalization, surgery, and then when you get into some of the MRIs and diagnostic and testing, that's where Original Medicare can get expensive. So number two is an option, and people do wind up with Original Medicare, sometimes because they want it, and others because they don't often know what else is available to them. Again, Original Medicare is Part A and B. So Medicare Advantage, also called Part C, is actually the most popular plans in America. Why? Because it's very similar to the plans you have now. You have a plan that has a monthly premium, but it also has copays. You're in a network. It may have a deductible. It may have coinsurance. And it almost always has an out-of-pocket maximum. Some of the out-of-pocket maximums could be $1,000. Some of them could be $5,000 per person. Each of these plans are uniquely different because each company or each carrier is negotiated differently for these companies and these plans. But Med Advantage plans are very similar. They may or may not even have a monthly premium, but they have copays, they have deductibles, they have coinsurance, and they have out-of-pocket maximums. And in your county that you live in now, there are probably 20 to 30 different plans that are available with between 5 and 8 carriers. I am personally licensed with 10 different carriers, so I have all of the options that you would ever need in the counties that you live in. But they all are a little bit differently, which is why there are 30 of them. They all have different copays and coinsurance and deductibles. But at the end of the day, there's two things that are really important here, is that there are, in 90% of the country, there's a zero premium plan in your county. Zero premium, okay? But you pay as you go. You might or might not pay for a primary care visit. Some plans have zero premium, some have $10, some $15. Specialists, most of them are between $35 and $50 a visit. The costly components are MRIs, x-rays, diagnostic, and for sure, the surgeries or the hospitalization. That's where these plans get a little bit expensive. You may be paying a zero premium, but you are paying as you go. Again, similar to the plans you have now, these are popular plans, they're familiar plans. An HMO plan means that you're in a network. A PPO plan means you can go outside of your network, possibly for a slightly higher cost. So let's just say for the moment that you were paying $45 for a specialist, but you wanted to go outside of your plan for a provider, a specialist that isn't covered. You might pay $80 for that specialist visit, but you can go outside the plan. So again, these are great plans. They also include a prescription drug plan for no premium. You're still paying your copays on your prescription drugs, but you're not paying an additional premium for your prescription drug plan. So again, these are really, really good plans. And what's really important is to look at your doctors when it comes to these types of plans. Now, number 4 is what's called Medigap or Medicare Supplement. These are very popular because these are still considered Original Medicare. They're Original Medicare in the fact that you can use any doctor or facility anywhere in the country that takes Medicare. Now, these premiums, depending on where you are in the country and what plan you decide on, it's between $100 and $300 a month, okay? But these are the best coverages in America, okay? So at the top end, at $300 a month, you're paying for that premium, but you're paying for no doctors, you're paying for no surgery, no hospitalization, no x-ray, no lab, no diagnostic. Some of the prices that are a little less than that, there's a $198 deductible, and then you're done. Another plan just below that is that same $198 deductible and a $20 office visit. But for all of these plans consistently, no cost for hospitalization, surgery, MRI, x-ray, diagnostic, lab. So these are really nice plans, again, if one can afford it. I know people who really can't afford it, but really need this plan because they need the flexibility of the doctors. These plans do require a standalone prescription drug plan. So depending on the prescription drugs that you take, the frequency, the dosage, the pharmacy, and your home zip code, we review all of your prescription drugs and we let you know which plan out there. Again, there's probably 25 different prescription drug plans that are available where you live. The average price for a prescription drug plan, standalone, just the premium, is between $15 and $30 a month. And that's in addition to the $100 to $300 a month plan for the Medigap plan or Med Supplement. These are wonderful plans. The price varies by state, but when we speak of plans like a Plan F, which many of you have probably heard of, Plan G, Plan N, there's a high deductible plan. These plans are wonderful because you have the flexibility of doctors anywhere in the country that take Medicare. On the Med Advantage side, you want to make sure that that doctor is covered within your plan, again, similar to the plans that you have now. So again, I just want to go back to this. These are the four choices. In conversations I have with people all day long, this is what I cover, and this is how I explain it so that people know they have choice. And in some states, you can change year to year without any health questions. In some states, that is not the case. New Jersey is a little less flexible than New York. Connecticut is like New York, but other states have their own rules around switching from 3 to 4 or 4 back to 3. Okay. One other thing is once you're leaving a group, an employer group plan, it's very likely you wouldn't be able to get it back. So it's very important to be very clear when one leaves their employer group plan that it is not the best coverage for them. Medicare.gov is a great website. It will help you, and it helps us on our end, evaluate your prescription drugs completely, and it will give you some details on the Part C, which is the medical side of a Med Advantage plan. And it'll give you a lot of information in general about Medicare, and will probably not as simply, because there'll be a lot of words, explain a lot of what I've explained here in this webinar today. So Medicare.gov is a great website. It's improved over the years and it continues to change. So Med Advantage plans, they differ by county. There are 4,000 counties in this country, and they all have a dozen or more Med Advantage plans. Again, similar to the plans you may be on now that are in a network. But as I said earlier, you have to have Parts A and B in place. You have to continue to pay your premium on a monthly basis. And there are zero premium plans available. And of the people who I help with Med Advantage plans, 60–70% wind up with a zero premium plan, but they know going into it that they're paying for various services. There are plans that are $16. There are plans that are $32. So it changes, it varies. because some of these plans offer dental, vision, hearing, gym membership, telemedicine, over the counter. There's all kinds of plans that are out there, and it depends on what's important to you. I often find that the doctors being in their network is most important, but for some people, dental is important, and for other people, gym membership might be important. But as I said earlier, prescription drug coverage is included. You still will pay your copays, $0, $3. You'll still have your mail order components within your prescription drug coverage. But there are additional benefits that are offered. If on Medicare and Medicaid, it's actually called dual special needs. And so there are different levels of Medicaid, but based on what level of Medicaid one might be on, one could get additional benefits beyond what it is that's even listed here. And again, it varies by carrier. So I don't think you can see this screen particularly well, but this is a doctor and facility lookup where we look at all the carriers that are out there that we are able to provide. And we go into their portals, their carrier lookups, and we check to see whether your doctors are covered, so that when we have a follow-up conversation with you, we're able to provide you with information on which doctors are a priority and which doctors are covered by a particular carrier or two. And then we can look at some of the extra benefits like dental and vision and gym memberships. So, my services is a complimentary services. It's no cost to you, your family, your friends. This is how you get information. That's my only pitch. Prescription drug plans, okay, they have to offer a standard benefit. In 2020, members pay monthly premiums if they are on a standalone. I said it was between $15 and $30, but it could be greater. On the Med Advantage plans, there is no premium, but there is an annual deductible on almost all of the plans, not all. It can be no more than $435, but these deductibles, and this is a really important thing to hear, is these deductibles on these prescription drug plans for Medicare plans only come into play when you have a medication that is a tier 3, 4, or 5. So that's what we do, is we go to medicare.gov and we check to see your medications, and we see whether they are tier 1 or 2, which are generic. But some of the tier 3, 4, and 5 medications that you might take, you need to meet the annual deductible first, and then the price goes down. I've seen medications that started out at $700, and then in the costing of that medication, after the deductible is met, it can go down to $75, $47. It's a dramatic change, but you have to meet that deductible. So there are co-payments, even if it's $3. Some of the tier 1 generics are $0. Some of them are $5. It depends on the carrier, but there are co-payments for some medications, if not most. But there are 4 coverage stages of these drug costs. The first stage being the annual deductible cost. After that, there's after deductible, there's the coverage gap, which used to be called the donut hole, and then there's catastrophic. It's all based on how much you spend and how much the drug costs at a retail level. And that's certainly something that we explain in even more detail when we're working together, so that you understand what drug costs will cost you. We are also always helping people try and find discounts on prescription drugs. The 2 most common ways that we help people, 3. If you live in New York, or if you live in New Jersey, there are pharmaceutical assistance programs. In New York, it's called EPIC. In New Jersey, it's called PAD, P-A-A-D. And based on income, one can get a reduction of their prescription drug costs. The other thing that we offer people and we guide them towards is GoodRx or Single Care, which are discount cards that are used separate from your drug plans through Medicare. And often that allows you to get a reduced price for your medication. And then there are other instances where we talk to people about contacting the pharmaceutical manufacturer of the drug, and see if there's some kind of a financial assistance or grant program that's available for people to be able to save money on their medications. Again, costs are available through Medicare.gov. So again, back to EPIC and PAD. These are pharmaceutical assistance programs, which I'm a very, very big proponent of. I'm always asking people about really their income or resources because it's based on that. But assistance from the drug manufacturer, GoodRx and Single Care is really very, very helpful for many people. And I can tell you that the medication cost and the concern and questions that we get around this is probably the biggest area of ongoing support that we are able to provide. So for more information, one would contact Medicare Direct. Go to that website that I mentioned, medicare.gov. Most of you, wherever you are, have a SHIP, a State Health Insurance Assistance Program office that you can speak to. They can't help you sign the documents to go forward, but they can certainly guide you towards plans that will help you like I can, but I can help get you to the finish line. And then there's the Office of the Aging. For those of you who are turning 65 soon, you will or have Medicare, you'll be getting a Medicare and You handbook. That's a pretty good sized book of reading that you can find out more information. Or of course, you can contact my office. So in summary, and we're right at the top of the hour. Each person's needs are unique. Your decision is based on your health, your budget, and your current coverage. That's where the time is spent in not only developing a connection to you, but also to understand what you're experiencing with healthcare and what you can do to move forward with Medicare. Premiums can exist. There are some zero premium plans, but then there's Part B premium. And what are those enrollment periods? What do you need to pay attention as you turn 65 and as you retire? We talked about the quality of coverage that Original Medicare offers, but it's still only % coverage. Employer or Medicare coverage, that is the question for people who are employed past 65 or with a spouse in that situation. We talked about Medigap and MedAdvantage plans. These are really the options besides group coverage that people evaluate. Even the retiree programs have what's called MedAdvantage and Medigap plans. They may be called something special from the district or from the agency or from the corporate model, but they're basically either MedAdvantage HMOs or Medigap plans where they're sort of flexible in terms of the doctors that you can utilize. The Part D is that drug coverage that whether you have LIS and get some subsidy or there's some state pharmaceutical plans, all important to look at as you evaluate that part of your coverage. And then Medicare savings programs are actually for people who are low income, who can potentially get some help in that $144 Part B premium. And again, it's based on income and resources. And that is what it's called is MSP or Medicare savings programs. So the 5 takeaways I'd like to leave you with here today is consider the timing of signing up for a Part A and B. We've talked about it, and I spend a lot of time in seminars. A lot of questions come from this part of it because people want to know exactly what their situation is. What's the story with COBRA, right? All of these things are connected. Review and evaluate your group coverage. For those of you who have used your group coverage, you know it well. For those of you who haven't used your group coverage, you really don't know necessarily the specifics of it, the deductibles, the co-insurance, or even maybe what the premiums are. Review your doctors and medications closely when it comes to Medicare. It's important. And in some cases, things do change yearly. Doctors are not forever in a network, though if they take Medicare, they're probably going to continue to take Medicare. It's a big part of their business. But I certainly come across doctors that do not take Medicare. And, they're in some of the areas of the country, New York, New Jersey, Connecticut, that the doctors don't need to take Medicare. And in that case, the Medicare plans, no matter which one you have, may not add value. But there are doctors who you use that certainly do take Medicare. Understand the difference between Med Advantage and Medigap as you make these choices, and find an independent, somebody who works with all the carriers, experienced, trusted, and Medicare advisor. So I hope that this was helpful. I hope that you're all safe. I hope if you have any questions at all, that you reach out. If you go to my website, you will see other webinars that I do on a regular basis. I do multiple webinars per month. If you want to hear this again, you're more than welcome to sign up. And again, I'm happy to answer any questions. I'm going to encourage you to download the handouts. Again, happy to answer any questions that might have come up. Are there any questions that have come up, Andrew?
Yeah, we have a few. So again, if anybody has any questions right now, there is the question box in the GoToWebinar dashboard. So just type in your question, hit send, and then that'll get sent to us and we'll take care of it for you. So the first question is towards the beginning of the presentation. They want to know what an HSA plan is.
Thank you. An HSA is a health savings account. It is for companies who have tried to save, employers who have tried to save some money and have a high deductible plan. So it assumes a high deductible plan. The high deductible could be $5,000, it could be $10,000. In some cases, the employer is making a contribution to the HSA. In some cases, it is being matched, or the employee is also putting in money into an HSA. You don't have to use your HSA in the same year that the money is put into the HSA. But once you get onto Part A, you can no longer contribute to an HSA. If your spouse is under 65, you can continue to contribute for your spouse. But if you are the employee and turning 65, you can no longer contribute to an HSA if you have Part A. People delay Part A knowing this information because they love their HSA.
All right. Next question is $144.60 a monthly premium.
It is a monthly premium per person. And as the chart that I can certainly go back to shows, is that's a monthly premium per person and spouse that is monthly and has to be paid. Part B has to be paid in order to have any other type of plan. And this income, if it's is based on income of 2 years ago.
All right. Does age of enrollment change with age of Social Security enrollment? For my generation, full Social Security age doesn't begin until 67.
Right. So that's a great question. And it is off because it is the same department through the government. These two subjects of Social Security and Medicare are often confused. The timing of getting Social Security varies from age 62, full retirement age. Like you said, this person's 67, and you can get bumps in your Social Security up to age 70. Medicare is strictly 65. Now, this Part B premium screen that you're looking at and other required minimum distributions or other income might put one in a higher category, and one might delay getting Social Security partially because of this. But getting Social Security and getting Medicare are really two separate issues within the same department and within the same website, and decisions should be made separately for each of them. I hope that answers the question, but they are separate, and Medicare decision doesn't start until age 65 at the minimum.
Great. Can you recommend a Medicare-related website that guides people who are already retired and getting a state pension? For example, this person's a former teacher.
Well, the website, Andrew, that you had directed me to look at some of the more details of the plans, which I don't have that in front of me, but you might. But Medicare.gov is generally speaking not for state employees. So, whatever component of the library system, the state group that this is sort of out to, and I looked at it, and I can say that I spent a little bit of time reviewing the plans that were online, and I can say that I wasn't 100% clear on the details that I was looking for to help me with this presentation. So my comment is that once one gets that information from the state or from whatever agency you're looking for, and you can get the detailed breakdown of copays, coinsurance, deductibles, and out-of-pocket maximums, I am happy to spend the time to review them and compare it to Medicare.
Sure. And in that case, for New Jersey would be the New Jersey Division of Pensions and Benefits. And I can certainly include that link in the chat right now so everybody can see if there are any state employees. It's a very large site. There's a lot of information, but there are some there are handouts that are able to be downloaded, some fact sheets and things, but you can always call and talk to somebody there for some more information. But that's pretty much where you would find things related if you're getting a state pension. So.
Any other questions that you had?
Nothing right this second, but we can wait a couple minutes and just see if anybody can think of anything else.
Well, again, I hope this was helpful. It's a lot of information in an hour, folks. When it's a live seminar, the questions come and they come rapidly once it starts. And so, again, everybody's needs are unique. And I'm sure there are questions, and it's just hard to utilize this technology sometimes. But don't hesitate to download the presentation, as well as some other pieces of help of the enrollment dates, as well as the 4 choices are one of the PDFs. There's an article there as part of the handouts that talk about employer group coverage versus Medicare. And then there's my PowerPoint and a brochure of my company.
And this program is being recorded too, as well. So you will have access to this. I will send a link to everybody so that if you need to go back and review anything, you can. Or as Mark said, check out his website, emeraldmedicare.com, and look for maybe upcoming webinars that he's doing if you think of other questions or whatever. So.
I want to thank you, Andrew, for the opportunity to be a part of this and help educate the people who attended today.
Yes, and thank you for presenting. It looks like we don't have any more questions coming in, so I'd like to thank you, and I'd like to thank everybody who attended today for continuing to support our programming. And please complete the evaluation at the end of this, and we will see you again next time. So stay safe, stay well, and have a great day.
Thank you all.